I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You've received the minutes of last week's meeting. What are your wishes?
Approval.
Okay, motion, is there a second?
Second.
A motion and a second. All those in favor signify by saying aye.
Aye.
Any opposed? Jeff,
I've got a utility permit for TC Tyson Internet for on 170th Street and Plow along the road. This is up there just north of the industrial park where Ziegler's at. There's a vault there, two houses, one on the north side, one on the south side. They gotta cross the road to drop internet to those two houses.
Move rule.
okay, we have a motion. Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? Okay,
Blade School wrapped up last week, Friday. Got pretty good feedback so far on it. I think a lot of guys felt like they got a lot of good out of it. But I haven't really talked to them since they wrapped up on late Friday there. Rain's coming this week, so we'll be doing some forms. We're gonna be starting in on the retainer wall for the sheriff's department here today, tomorrow, this week, get that knocked out. So, blacktop services can come in and blacktop that parking lot.
Yep.
The shop is still reviewing the truck quotes, so I don't have those for you guys to act on. Hopefully next week. Got some forms pipe to do on 270th. They're just straight north of Green Products, mile north. Between, just off of Highway 14, first mile between H and
What are you doing there?
14. We're taking out a bridge,
Oh, that crummy little bridge?
yes. It's super narrow with
Yeah,
the
with Two
guardrail.
different side guard.
Yes. And we're gonna put in a triple 66 pipe,
Oh, that'll be nice.
yes,
I won't have to go around that.
yes. So. We'll have that done here, we're supposed to get that done and then continue ditching, rocking and blading, so people might start seeing some new blade techniques out there. So don't get too excited.
do you have any public stop and inquire as to what was going on during the training or
Nope,
no?
I
Okay.
don't necessarily know of anybody.
It looked like you really had that road tore up when I drove by.
Yeah, we're gonna, I just want to sit here today after the rain and see if we need to put some rock on it, but we did find a lot of rock in the four slopes. And got that pulled up on the road.
That's just the edge of the,
Yeah.
because I saw that they bladed down into the ditch. up on the
Yeah.
road.
So, because there are 12 people, or we had 10 blades out there and 10 guys, or 12 guys doing it. That little drop off is only supposed to be like 6 inches to a foot wide.
Oh, so everybody had to get.
So everybody had to get down there, grab a little bit, and they took it all the way to the four slope, but that is what a good. Supposedly, what would take a year was done in a week to that road. So, to cut that four slope to get those marking cuts. Down there and pull everything up and move it back and forth. So. Hopefully our guys will start implementing those new techniques. And it'll help improve with our overall road system.
Hmm.
Yeah.
Good.
Anything else that you have? Where's,
Probably, but I can't think of it at the moment.
any questions for Jeff this morning?
Oh, Aspro, I have not heard anything, so we're still thinking end of the month. For Pioneer Road, but haven't heard nothing.
Mhm.
This ain't different.
We're gonna meet Marty out there after a bit. We got a little bit of a tile issue I think we need to discuss with him, so.
Okay.
My brother and I are gonna meet with him out there.
Don't rough them up too bad.
Huh?
Don't rough them up too bad.
I can't do much roughing up anymore.
All right, No, thanks, I guess. Katie?
Yep, I am
You are
here
up.
to talk about the opioid settlement funding.
Yep.
You're Heidi.
Yeah,
Um,
mhm.
Erica just got back to me that she didn't get the resolution.
Yeah.
So,
So,
want me to talk about it?
yeah, if you will, as I explained, with the opioid funds. The committee will meet, make recommendations to the Board of Supervisors and we'll try to explain better what those recommendations are as they come up, and then we will pass the actual funding by resolution. So yeah, if you want to explain the one program that we have
Okay.
recommended.
Yep, one of the things we talked about last week, so for Grundy County Public Health, since before I started in 2014, well before that. We had a substance abuse prevention grant, so that was $10,000, that covered for various curriculums, prevention activities offered in the county. Since 2015 or 2016, I've been implementing a life skills program. Jordan got trained on it last year, so she started implementing it as well. We currently go to 4 schools with that, and it is a research-based curriculum program that is supposed to help with prevention of substance use. And since that grant is now going away, it falls under the behavioral health realignment, we lose that $10,000. So we thought we could utilize the opioid settlement funding, at least for the next year, if not more, depending on how much we get, to still keep that in the schools. We survey the schools every year to see how much they like it, and they love it, and they don't want us to leave yet, so we would like to see about utilizing it for that, because that's a huge chunk of that $10,000 that we use is for that specific program. But we thought about also just taking that $10,000 and just shifting it all over to opioids in terms of any trainings that we would have to do, like Jordan getting trained for life skills, because that's another training fee. Any webinars that we have to do to keep up on trends and updates for substance use in the county and in the state and the nation. Social media weekly, you do weekly sharing for substance use stuff and monthly stat taking. So we just figured if it was okay, it's supported by the committee, but if it was okay by the county to just shift that $10,000 from that substance abuse grant that we will no longer get and go to opioid funding.
And with the opioid funds, they are more specific than like the ARPA funds were, and so this does fall under their,
Prevention
they have a
activities.
prevention education category, and so it does fall under that, and yeah, we would be able to utilize it for years. We don't have an ending date right now,
There's
so
no ending date.
not so far for the opioid.
Keep that hopefully.
Cause it was supposed to be a 20-year settlement. A lot of the companies are settling sooner or, not making they're making larger settlement payments. So it could be that in time, there may be something come down with a ending date, but we would have to
But at
adjust
least
at
we
that
get
time.
it for another year and
Yeah.
then maybe the year after that,
Yeah.
and then that way we can just keep playing it by year every year that we do
And-
this.
And then see too, by that time, the behavioral health system, right now it's changing. I think it's gonna go through some changes as they adjust. And then we'll know a little better too, how that will all shake out, I guess. So. So yeah, I guess there's no action today, but if you have any questions for Katie about the program or for Jordan.
We do report on it to you guys every time that we report on things about the classes that we work with, and if you ever have any specific questions about the program, don't hesitate to ask.
And I think you were gonna check with AGWSR with the different, they've changed them.
That's what you guys had said, that they
Yeah.
might be adding third and fourth back into.
The students are shifting
Wellsburg.
where they're at, somewhere from Ackley and Wellsburg, so it could be that they would be able to go into Wellsburg with the
Currently, we
AGWSR.
the Grundy Center for third and fourth grade, Dagny Harper for third grade. Sorry, Grundy Center for fourth grade, Dagny Harper for third grade, Rhinebeck for fourth grade. That's the same curriculum. Timothy Christian, we also go to, but since they have dual classes, like their third and fourth is together, so we don't want to go to their third and fourth grade class 2 years in a row, because then those third graders, to go to fourth grade, they're gonna get the same curriculum. So we alternate years with them. We do third and fourth grade 1 year, then we do the middle school curriculum for 7th and 8th the next year. That way they're still getting something, and they really enjoyed it. It's so much fun over there. But yeah, we thought we would see if AGWSR could get in on that. And then we've asked BCLUW in the past, but they were at one point getting some very similar education from Marshalltown or Marshall County. I don't think they're getting that anymore, but I've been having a hard time getting in there, but we might try again.
To see if they would think that'd be.
We don't have a dollar figure.
I can get you one because it's very easy for us to figure it out, because we already have the budget set from the grant that we use. We'd have to do is update our wages, since that changes every fiscal year. But yeah, we could easily get the breakdown for you. I mean, I've got the list of things, we prep and post for each lesson, travel time to and from, mileage, printing of the worksheets that we utilize, scheduling discussions as well as schools, educational materials, we could easily get that broken down for you.
Oh, right now, you're asking for the 10,000.
Yeah, just the 10.
It would be 10,000. And currently we have, I believe there's probably close to 140,000, maybe more than that we've received from the opioid settlements. So, yeah. But yeah. Do you have any other questions for Katie about this program? Like I said, Erica is drawing up the resolution and she'll have it ready for us. And we'll be able to look at that then. But otherwise, you got any other department updates? Anything going on in the health world there?
There's that outbreak of measles.
There's nothing going on.
Didn't know if you guys had any questions about that, but I've been including you guys on the emails that we sent out to the.
Mhm.
So don't hesitate to ask questions about any of that fun stuff too.
Because anybody can go and you can get like a vaccine at any age. There's no.
They don't
how does
recommend it if you were born before 1957 because you were probably already immune to it, having been around it or having had it at some point. And then most kids who are in school systems from, I forget the year they said. I think it's the late 80s, early 90s, they should have the 2 MMRs. There's a group of people, me included, that do not have 2 of those vaccines because it wasn't required for us to. So it would be easier for people in my position to like get the titer, see what our antibodies are, and then maybe get that second one. But even with 1 dose of MMR, you have 93% effectiveness against the disease. 2 doses and full immunity, then you've got 98% effective against the disease.
Okay.
It's not a fun one though. There's been 3 deaths from it so far, 2 in children. And it leads to things like encephalitis and neurological issues and deafness and blindness, and it's not a fun one to have. And it is the most contagious disease that is currently out there because of how long it stays in the air. It's up to 2 hours after somebody sneezes. So if you think about it, if somebody has measles, they go into a clinic room, they have to wait at least 2 hours after cleaning it. After that person leaves, clean it, and then wait 2 hours before anybody can be back in there. That's a pretty long period of time. Or if they're in a Walmart or a Costco.
It was interesting where they said, you know, they went to Walmart
Yep.
or a shopping center,
Yep.
I mean, that was kind of interesting.
So anybody there, like,
Track that.
because they don't know the exact time frame, but you have to think about a couple hours afterwards. It's a huge time frame. Talking at least 5-6 hour time frame. That you're looking for one location that one person was in, because one person can infect up to 18 people.
Seems like back in the day when I was younger, measles was a very common disease.
It was, because it was before there was vaccine, it was before vaccine prevention came about.
Measles, chickenpox and mumps.
Yep.
Well, we had all
Right.
Was it just as bad or as deadly or?
Yes, it was. There was up to 400,000 cases that were hospitalized, mostly children, before vaccines. There's like, what did they say, 5,000 to 10,000 kids would die from it every year before that.
Mm.
So I guess it just depends on your definition of severe. And like I said, it's always led to encephalitis. It's always led to deafness, neurological issues, infertility. So if you're one of the lucky ones that didn't have any of those things happen, great, but that's not how it is for everybody. Just like every time you get in a car, you don't always get into an accident, but do you usually put your seatbelt on?
So you said anyone born prior to 1957 has natural immunity?
They're supposed to. Could that change depending on the person? Yeah, because if your immune system's shot, then that could be a factor in it. But you just work with your healthcare provider and decide what the next best option is for you. They're probably not gonna give you an MMR though.
Were you born before 1957?
If you are curious about your immunity status, or if you need an MMR, you can contact us. We can look up your immunization records in the state system. If your provider has kept up to date on that, it would be documented in the state system. We can look that up.
I remember having the measles.
I'm glad you're good.
Well,
Well,
You don't know how to.
we can say there a lot.
This is what you got.
Right. So other than measles, is there anything else that you're
Just kind of
seeing?
a slow time because out of schools and getting ready for the next grant year and. We did do an infectious disease tabletop. I think I mentioned that at the or the department head meeting, so. Thank you, Chase, for helping in the community with that.
It was interesting. Jordan, as far as going into schools, what are your thoughts? You've done some teaching.
Yeah, I love it.
They say the darndest things, don't they?
Oh, they're very honest. I love their transparency. But they're,
You're tall.
yeah.
Yes,
You know Michael Jordan? No, it's not my last name. Not related. They're just a funny bunch, but they're the best. It definitely brightens my day. It's definitely one of my favorite parts of my job is going into the schools, and I know half the staff, I feel like. But since I graduated from Preschool AW, it's kind of like, oh, like I wish I had that when I was in school myself. So it's kind of just like, wonder why they don't have it. Just because I'm like, oh, I would have loved to have that, and they remember you, and it's just nice. So I wonder if we could, maybe I could,
Keep working.
yeah,
work it.
pull some strings a little bit, be like, since you know me so well. But yeah, it's good.
Good. Any other questions for Katie or Jordan this morning? All right, thanks, Katie.
Thank you.
Jordan. Chase. What you got for us?
You get all four of them.
I can get old.
Yeah.
Glutton for punishment. Alright, so Senate file 659 was signed without a veto. And I listened to the 911 council recording. They kind of gave a rundown of how it's gonna work. So they're going to run through all of their reserves at the state level, everything that they have, and it's supposed to get them until like the end of the calendar year. And then every quarter, they're going to go through their budget, and then they will send out the invoices to the counties. The state is not going to operate on a surplus. Their goal is to just zero out every quarter. So they anticipate taking about 13 to 15% of the local share to feedback and pay their bills. We haven't had a 911 meeting yet. It was brought up, we can either make the state invoice us and then send them a check, or as a 911 board, we can send them a letter, say, no, just go ahead and keep our 15%. And then we don't have to do all the paperwork. But went through some of the numbers, and on our last annual PSAP expenditure data collection that was submitted for fiscal year 2024, 15% of what we reported from the surcharge would be $23,649.32 that the state would be keeping. Now, to go with that, at the last 911 meeting, maybe 2 meetings ago, we just approved a new paging based system down in Conrad. That's 24,000. So we're losing out on about a project a year in paying the state. Then also what we use some of the 911 funding for is portables for myself, sheriff's office. We paid, Grundy Center ambulance has gotten portables through the county 911. We do help with some radios to the fire departments. And in 2023, those prices were about $5,000 for single band portables, and a new mobile unit was $8,300. So I mean, them taking 23,000 is going to really eliminate what we can start upgrading on. The new repeater down here in Grundy was 16,000 when we put that in. We're gonna try to up, they're really out of date. They're like 30, 40 years old. They're not even truly repeaters. They're just patched together between the two. And those are about 16,000 a piece. Then factor in inflation. This is really gonna hurt how much we can update. There is a webinar coming up Wednesday where they're going to go over what the state plan is with all of this. And if you guys want to participate, I will forward you the email. I think LJ, you might already have it.
Yeah.
I'm gonna listen into it where they're gonna talk about the implementation process.
Yeah, if you want to forward that to us,
Yep.
please. Thank you.
One bad thing that came, well, there's a lot of bad things that came with this. One other bad thing, the original proposal was they're finally gonna put a deadline on how long the state could take to implement this next gen wireless call taking ability. That's completely gone. So the state can say like, hey, we're gonna just keep dragging this out and take your 15%. the original proposal at one point was the local share went down to 45% when the state kept theirs, and then would go up with being able to take 15% from everybody on a quarterly basis. They still got us down to 45%. Homeland Security Emergency Management Director Benson, they're already pushing hard to get the language changed. They don't like the language. Blake down at 911 doesn't like the language. It's too vague. It got passed through kind of at last minute that they don't like how it's worded. So there's a big push to change the wording, and there's a big push from sheriffs and deputies, APCO, NENA, Iowa Emergency Management to just raise that surcharge. If they would raise it to $1.50, $2, this all goes away.
And nobody would know the difference.
No.
That's the worst part, is nobody would know the difference.
Yep.
But they will know the difference when we don't have the services they need.
And this is the second oldest, like budget. The only state group that's operating on an older budget is the Fire Service Training Bureau. Otherwise, everybody else's budgets have been up over the years.
Not that either of those budgets would be important at all.
So why have they not?
Interesting.
I mean,
They-
obviously things go up.
Yeah, they haven't really-
Budgets go up. Why are we doing?
They haven't really given a reason. The Fire Service Training Bureau's had its own, issues. I don't know if you guys remember a couple of years ago, they had somebody embezzling money from the Fire Service Training Bureau. And stuff wasn't getting billed, so like they weren't getting money coming in, and what was coming in wasn't making it to where it's supposed to go. But it's. On the 911 side, we have tried to do in my almost 3 years, and Kurt can say more, we don't really come to the county for money. This is gonna make it where we might have to start coming to the county and asking for help. That way we can upgrade this infrastructure and not just rely on the surcharge. A lot of it is going to the wireless side. I was looking at previous years, the first one of these data expenditure forms that I did, the wireline surcharge that the state doesn't touch was like 31,000. Last year it's down to 27, and I bet it's lower this year just because wirelines aren't prevalent anymore. Certain wireless surcharge is going up, but as that surcharge goes up, it's a percentage based thing, so the state's cut is 15% of whatever the next highest number is gonna be.
So I find it interesting, this was passed even with vague language, and yet another bill that came across her desk was vetoed because of the vague language. Interesting.
I wish I was here a couple weeks ago when Meggers was here and he talked about how we had an undesignated $300,000. It was left that way because we were going through the dispatch project. I don't want to allocate money and then have to explain to the state why that number is lower the next year when we're saving it for something. We're just going through bigger projects that we couldn't, on the form, tuck it away in the right spot. But otherwise, we're going to the state and having to explain, well, how come this number is lower? Well, we had a big project coming through, we had to dip into it. We did submit when all this was going down, the quote for this base, a lot of the stuff for the dispatch center that was upgraded and the cost of upgrades. We sent that down with APCO NENA to present to them, and they still said that, well, why are you guys saving so much? The tower costs close to $1 million. Another thing, for like, if we would need to change the light bulb out of the one there, it's $5,000 to get a climbing crew on site to even go to be there to climb that tower to change the light bulb that we have to have for the FAA. I'm in the wrong line of business. I was on top of grain bins changing those light bulbs for a lot cheaper.
4,500.
Yeah. $49.99 I go up there.
Wow.
Yeah. So are they promoting like for the big projects, you'll have to bond for them, or what is their solution?
I know
for-
Hardin County, I think they did bond for their radio upgrade,
Yeah.
but I mean. And not coming to the county for money prior, we're trying to stay away from that and be responsible and save money. But they're kind of taking that away from us. They don't want to be a burden to the taxpayers. Well, if we have to come to you guys, it's still coming back to the taxpayers in one way or another.
It's just a different group doing the asking.
Yeah, one of the legislative members that was championing this whole thing, said, well, the locals can do their own surcharge. They used to be able to, that got, written out of code in like 2013, so we can't do our own 911 surcharge locally, it's all done through the state.
So when Mingers was here, he said, when I asked him that question, he said that Homeland Security is running out of money.
911 is running out of money.
But Homeland Security is not.
No. But Homeland Security is going to be the ones in charge of this, because 911's kind of tagged in with them now. So that's why Director Benson was the one that talked to us about it. And I think he'll kind of, along with Blake, I don't know how to say his last name, so I'm not gonna butcher it for him. Yeah, they're kind of gonna be the ones walking through the implementation process, and they're kind of on damage control right now, because there's a lot of outrage and they're the ones catching all of it, while the legislative members are on break and campaigning and walking parades. So 911 runs it, but Homeland Security, it just falls underneath them.
And a lot of it,
Everybody's solution was to raise the surcharge
Yeah.
on cell phone, and the governor didn't wanna raise taxes, so.
But inevitably, it's gonna. I mean, someone's gonna have to.
Yeah.
Yeah.
Right.
It's like everything. I mean, it'll be on the counties and the cities
Yep.
too.
They basically went to all the counties and said, oh, you have all this money sitting here, you're not using it, so we're gonna come in and take it.
Yeah,
Like
like,
everybody's saving it for a huge project, but we're in the process of saving it, trying to build a new tower down in the Conrad area, so. And it's, $1 million, so.
and at one point, we did have close to $500,000 saved up, but as you're saving money on the smaller amount, the other radio infrastructure started to go,
Yeah.
so now we're playing catch up again. Or if they would raise the surcharge rate, and even if it's 50-50 on a higher rate, just. I know Dallas County, they had over $1 million saved, because they're planning a big tower project, and they were one of them that was targeted, like, why are you saving so much? And apparently towers aren't a good reason.
did they give you what a good reason was?
Probably anything that puts money in their pocket.
Interesting. So what can we do? Contact them?
Contact them, that's the biggest push that we're getting from, Iowa Emergency Management, sheriffs and deputies, APCO, just stay on your legislative people, like, this has to change.
Meggers was one of the sponsors of one of the original bills, so.
And the surcharge increase would be the best way to go, the easiest way,
Mhm.
and the fairest way.
One thing they talked about too, right now, the wireline surcharge is it is up to the locals to collect that. The state would take that over. They estimate like an extra 3 million revenue that could be shared through everybody. But I guess that didn't make it in there. So it's still up to, like, here locally, it seems like all of our local telephone providers pay what they're supposed to. I'm sure in bigger cities, you get some
Probably doesn't.
business that lasts for 6 months and then goes away, or just outdated stuff that they don't pay the wireline surcharge, but that's less and less too. So it's not a reliable source of money there either, compared to a cell phone that everybody's got in their pocket. You got a family with 5 cell phones. Cell phones are the new home phones. I know people that have a cell phone that just sits at home for their kids.
So. All right. Any other questions on this bill? Otherwise, any other updates for us, Chase?
Not on the 911 side, EMA side, a lot of outreach. I was down at the Conrad Library with our fire extinguisher trainer. That was the first time we've got kids in it. They really seem to enjoy it. Found some new stuff out. There's one where it's just reacting to smoke alarms. So we had them pretend to crawl out of the windows and stuff that come up virtually. A couple library programs. I actually went up to New Hartford because their head librarian heard about what we were doing in Dyke. And it's starting to spiral out into other counties, so that's good. One of their helped their EMA get that started. Back in May, I did a first aid choking program with the 6th grade at Wellsburg. Since a lot of those kids are starting to stay home by themselves. One cool story out of that, the next day they had a kid choke at lunch, and somebody that was in the class jumped up and gave him Heimlich. So the
Nice.
training's getting there.
Good job. Yeah.
Other than that, it's just waiting for the new fiscal year to start so we can get started on the next project.
Keep going. All right. Any other questions for Chase this morning?
How many members on the 911 board?
It is,
So
it's not as many as it's supposed to be because we have to include everybody that has fire or ambulance territory in Grundy County. So I think we're actually up to like 14, because Ackley's supposed to be a voting member, Appleton, Parkersburg, New Hartford, Whitten, Union, Eldora. Gladbrook has that little bit here.
Really?
They don't come to the meetings unless, and we're working on the 911 side, we would like to, it's been talked about prior to the dispatch upgrade. Start giving back to the local communities like 2,000 for new pagers, radios, whatever, to help ease the city with that, because if you're looking at a new fire truck and $8,300 in 2023. The sheriff's office does do a good job of mobile radios that are taken out of squad cars that aren't out of date, offering them to the locals. Same with the portables. I think those went to GCPD to help ease that burden, but pagers and whatnot are expensive too. So even just offering some money back to them. And the 911 money has to be used for receiving or dispatch of 911 calls. So they can't use it and go buy a computer. It has to be for radios and dispatch. But if you're looking at 2,000 for a community and we've got 14 people supposedly or potentially that could be coming and asking for money, that's $28,000 out of the budget on the 911 side. There was some legislation that died. I don't even know if it made it through the funnel, where only in-county members could be voting members, which would help us. Because like Hardin County, if they move to Essex, why would we be helping them buy radio equipment that's not exactly compatible with ours? Same with New Hartford, Parkersburg, Butler County, they're kind of on a different radio system than what we are. Hudson's another one coming in from Blackhawk, but they're also a Raycom Sarah system, so. They could still come to the meetings, but they wouldn't be able to vote on anything. I think historically, maybe only Ackley was coming to meetings prior. That was when they wanted to get some extra money, from what I'm told. That was before my time.
Thank
So, thanks, Trace. Okay, you have received a copy of the bills. Are there any questions? Otherwise, I would take a motion to approve payment.
So moved.
Is there a second?
Second.
All those in favor signify by saying aye. Any opposed? The next item on the agenda is the appointment of Jay Menninga as the Shiloh Township trustee. We had a resignation earlier, and after checking with Isaac and Erica, it has been approved, that he would be a suitable candidate for replacement. So, if anyone would care to make a motion.
Why did you have to run it by Erica?
He lives in town, and we had previously, we were in the habit of appointing only rural members,
Right.
but he does also own farm ground. And after checking, as long as they are in the township. So if a rural member would move to a town no longer in his township, he would not be eligible. But
Okay,
as long as they
that's a
reside.
good update for me because I didn't realize that.
So, yeah, nope, it is, nowhere in the code does it say that they have to reside in the rural areas. So did check that out. Would anyone care to make a motion to approve that appointment?
Make that motion.
All right, is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? Okay, thank you. The next item is we have a audit services RFP that has been sent to you. Discussion and possible action. Is there any discussion?
Well, it's an extensive document and it looked to me like it covers everything that we certainly need.
Should
right?
be, it should all be in there. And, I think the dates are suitable as far as getting it done as quickly as possible, but allowing enough time for those that need to complete the RFP to get that time.
Be back by July the 11th or something like that.
Yes, and I did
Yep.
find out that the state auditors, they do have a date scheduled with secondary roads to start, I think, an inventory on June 30th. they could push that back if needed. But
I guess it would be on them to decide what they'd like
yeah,
to do.
Jenny had reached out. to her. So we'll see. Cause you guys can still do your part. They just may not come in they may not come in that day. So we'll see.
Yeah, here in the next 2 weeks, we're gonna get the guys together to
To do that.
start doing inventory counts.
Okay. All right. Um. I guess the action would be to, make a motion to have Alan send this out. Would it be possible to maybe reach out to the other auditors through Base Camp and see if other possibles,
They've got a
Yeah, we have-
couple.
the state, okay?
So who do we send this out to?
We would probably want to send it to the state, and then there are other firms that work for other counties,
So we do have a list that we would.
you have
There's a handful.
some. I don't know, I know before we send it out too, if that list is around, and I don't even know if any of those are
I'll get that list to you today
still in
and show you.
business.
Because it,
Um,
my opinion is it should be sent to, you know, more than just one.
yeah. So if you would check with get as many possibilities from other auditors in counties. I guess if anybody else knows of anyone, but that would probably be the best way to reach out, and then to send it to as many as you,
Maybe my recommendation.
Yeah.
Will do.
from all other audits being done.
Do you need a motion to?
So I would need a motion to approve this form being sent out to potential audit firms.
I would make that motion.
Okay. Is there a second?
I'll second.
Okay, all those in favor signify by saying aye.
Aye.
Aye. Any opposed? Okay. Any board and committee meetings this week?
And Phil. Paid bills. Just. Oh, there's some grass seedings up at the landfill that need to get redone and stuff like that. Pretty short meeting.
Yeah.
Otherwise, everything was going good.
Mhm. LJ, no?
No.
Okay. I listened to the community partners meeting, which is held monthly, and, there's some, changes and uncertainties there, but otherwise it's always a good program. And then the opioid committee did meet this week, and there's some good ideas out there that, will be coming to you. Anything else? Butch, you got anything for us today?
No, they're starting over there at the sheriff's office to do that. Fix Allen's air conditioner last week, keeps complaining that got hot. So.
That high? Okay.
Complaining.
Keep it
Door
cool.
decal worked good.
Yeah,
Well, they turned out well.
that's good. Kirk, anything you'd like to report on?
Well, we were down to 0 inmates for about 1 day. And we're at about 10 now.
No,
It didn't last long.
no. Word got out how great it is to be over there,
Yeah.
or- okay?
Put out your vacancy sign and everything.
Yeah.
Mm-hmm.
So.
Anyways, anything-
Anything?
okay, otherwise, anything else to come before the board this morning?
7th Street's gonna be closed on Thursday, 7 to 10. For dinner on the bricks.
Yes.
Celebration.
Main Street, Chamber Main Street, okay. Otherwise, if there's nothing else, I would take a motion for adjournment.
So move.
Is there a second?
Second.
All those in favor signify by saying aye. Any opposed? All right. Thank you.
No, I don't.